Okay, logging into NextGen. On your desktop, you'll see a NextGen icon. There's a couple here. The one that says test is not the correct one. It looks like actually either one of these would do fine. We're gonna click on the NextGen. You're going to get a username and password. Oops. That you're gonna log in with. Once you're logged in, you can hit enter. And in some of our exam rooms, Mission Viejo especially, but it happens in San Clemente also, it will not load on your main desk computer. It will actually load on the screen where our eye chart is. So you have to grab your mouse and slide it back over. So then you can open it up. You're gonna get another icon that says NextGen, and you'll double click there. The EHR is for the back office. This is electronic health records. The PM is patient management. If you're in call center or doing check-in, check-out, you're gonna be using the PM. If you're doing patient workups or testing, you're gonna be an EHR. So for right now, we'll go into EHR. Another username you'll be given, and another password. And then under practice, you want to put Tayani Institute. Unless you're in the surgery center, then you hit login. Then you're gonna select your location, SC San Clemente, MV Mission Viejo, LH Laguna Hills. This is IR is Irvine, CM Costa Mesa, BB Big Bear. We also have San Diego Eye Care, which is our Oceanside practice, and we're adding a few more. So just make sure you're in the right location. So today I'm in Mission Viejo. You put your provider, whoever you're working with. And once you do that, it should pop up. And I'm gonna not have the patient's names on here. So you can verify here, you have Mission Viejo and your provider listed. In your inbox is where you're gonna see all your patients. Due to patient confidentiality, I'm gonna not pull that up again. But when you have your inbox, it'll show you everyone coming. We can put in a test patient at this point. We'll put this test patient. Once you have a patient chart open, as long as they've come in, there will be a date with today's date and your provider. Once you have that, you can go down to the little squares, and as long as you have put in your preferred preferences, your templates, you can go to homepage OPH. Otherwise, it'll be in all. You can go to my other video that shows how to put in the preferred template. You'll go into the template, and then we have all these tabs up on the top. I'll go through each of those tabs in just a second. This is the Home tab. The Home tab just kind of gives you a synopsis, but there's not really anything you have to click in it. Intake. This can show you your health monitor is like when they had their dilated eye exam, when they had their pressures checked, that would be an IOP check. Different things can be viewed here. You can scroll down, you can even put the reason for their visit. I usually don't do this in the intake portion. And then the main thing on the intake is you want to do review of systems. Usually I just would click on the global normal ophthalmology and hit yes. Okay, I mean, once you're there, your intake's pretty much done. You can go over to the histories tab, and in the history tab, you want to review everything. So you're going to ask them, do they have any past ocular history? This patient does. They've had narrow angle cataract glaucoma. If you need to add something, you're going to click on the add button and a screen will pop up, and if you want to hit cataract, a little drop down, you can just put cataract, okay. OU means both eyes, OS means the left, and OD means the right. RUL means right upper lid, RLL means right lower lid. Those would apply if someone had some sort of lesion removed from their eyelid or anything regarding the eyelids. So you have left upper lid, left lower lid, and then the BUL would be bilateral upper lid or bilateral lower lid. So you can put, they had cataract surgery in both eyes. We'll hit cancel. Sometimes it's hard to get the date in. You can probably put in, just type in a year is probably easier than trying to find the specific date. You can put in like 2003, save and close, and it says 2003. And then you can hit save, close, and it'll add your cataract. I mean, that was probably already in there, so it added it down here. If you need to remove something, you can as well. And then once you're done adding any past ocular history, you're gonna hit reviewed and updated. On the medical history, again, you can add in any history. Diabetes is very important that we know, hypertension, cholesterol. Any history that the patient has needs to be put into the medication history by hitting add. And you can type in it, you can use these little dots here, coronary artery disease, or if it's something that's not listed, you can type it in. You can say, I don't know, let's say Graves or something. They have Graves disease, you can type it in. And then once you type it in, if I could type in, right, there we go, you hit add to grid. It's very important to hit add to grid and then hit OK.